Okay, first of all, welcome. And before we start with anything, I would like to know your name as well as it's been how many years you have been practicing.
Both of us are actually from the same batch. We are colleagues from KM Hospital. So both of us are practicing since last 10 years actually. We have passed on to 2013. Myself, I am Dr. Pranav Chajar from Nasik. And
I'm Dr. Altaf from Aurangabad, Maharashtra.
So, Dr. Pranav and Dr. Altaf, welcome, very, very welcome. So, let's start with few questions over here, random picks रहने वाले. So, I want you, अब आपकी field से related है तो obviously you are master in that. Okay, so let's hop into first question over here. What lifestyle modification would you recommend for BPH patient to lead a comfortable life?
okay. The most bothering symptom for a BPH patient is nocturia only. So I would suggest for those patients the lifestyle changes in for a BPH patient who is primarily suffering from nocturia, which is increased frequency in the night period, is to restrict his fluid intake from evening onwards. I mean, for 3 to 4 hours prior to his sleeping duration, he is supposed to cut down his fluid intake. So that will help in reducing the urinary volume which is produced during the period of night. Thereby, it will reduce the frequency. And the other change would be to increase his active lifestyle actually. So increased activity can go a long way in modifying his irritative and bothersome symptoms.
Okay. Anything you would like to
Yeah, yeah, it's very important. Nocturia. They also have the frequency urge incontinence. They're quite bothersome when the patient is in working scenarios in the offices, and so apart from fluids, that kind of fluid intake is very important. Like a lot of beverages, they are diuretics, and there's salted food items. They have a lot of this effects. Citrated foods, and they although their intake has to be limited. All this irritates the bladder and it causes the urgency, frequency, urge incontinence apart from the fluid intake.
So, what according to you is the best treatment for BPH?
Best treatment in the sense if it is medical management, I would say the most time tested and the most uh, the drug which has been in use since the most long duration are alpha blockers only,
Okay.
which would include alfuzosin, tamsulosin, and celedosin. Basically, the usage of this drug would depend upon the age of the patient, um the activity of the sexual lifestyle in the patient. I mean, how sexually active is the patient, and how uh, comorbid is the patient. For a patient who is very into his old age, very comorbid and fragile, I would prefer to use celedosin, which is in the sense which is producing lesser amount of hypotension. So it would cause less amount of postural hypotension. Thereby, there would be lesser episodes of giddiness and dizziness. It would reduce the number of episodes of falls. For a patient who is much more sexually active in his 50s or before that, alfuzosin would be a better drug to utilize. In the sense it is having lesser amount of adverse effect profile on ejaculation. And for a person who is like economically constrained, for them tamsulosin would be the drug of choice because it is more economical. In the sense it is lesser financially constraining on the patient. So that is how we are going to.
Yeah, BPH as such, BPH is benign enlargement. We say it's a physiological term, and as the age increases, the prostate increases. Rest of the organs they do regress. So BPH, the disease is entire spectrum. We need to understand that most of the patient may have bigger glands, but they may be absolutely asymptomatic. So first we have to categorize the patients, like who all require absolute indications of the surgery. Patients have recurrent fevers, UTIs, stone formers, then hematuria, passing the blood in the urine and causing the upper tract damage like renal insufficiency. Those are the patients where we cannot take a chance with the drug. So we directly offer them a surgeries. And in the medical management, yes, we divide the patients in mild, moderate, and severe symptoms according to the International Prostatic Symptom Score Index, and also the patient's bothersome symptoms. Like a patient may be very bothersome with minimum this thing. So we need to first in the mild symptoms we tell them for the basic lifestyle behavioral modifications, fluid intakes, and the time of voiding. And the patient really needs a coming the worrisome about the symptoms, we do offer them a medical management like my dear colleague has mentioned about it, alpha blockers, and then we ask them to follow like where they response or not, how is the progress, how much is the response, and depending on that the further strategy is developed.
Okay, heading towards the next. When does surgical intervention become necessary? Can it be avoided?
Surgical intervention, actually there are straightforward indications wherein the surgery would be much more preferable over the medical management. Like if the patient has gone into retention, which is refractory retention despite of medical course, if the patient is not able to achieve spontaneous urination, in those patients definitely one would have to go ahead and do a surgery for him. Then if there are like changes of upper tract, if the kidneys are getting affected, if the patient is developing upper tract changes, then this patient would be more preferably be treated with surgical intervention, which would be much more effective in reducing his outlet obstruction, thereby improving the dynamics and reducing the pressures on the kidney. Then occurrence of recurrent hematuриas, recurrent infections, formation of stones in the bladder. These are the indication wherein the medical therapy would not be that effective as against the surgical intervention. And about this having the surgery, yes, if in the early course when the bladder changes have not happened, if that time the medical management has been started, it would reduce the modifications which has been happening in the bladder. In this small subset of the patient, maybe the early intervention with the medications can save the surgery in the longer run.
Okay, last one. Any message that you have for all the aspiring, or we can say the upcoming urologist? Altaf sir, please.
Yeah, my message for upcoming urologists, like you treat according to the case scenarios, the case per case. Like we hit the ball, when it's a full toss, we try to hit the maximum score. So according to the merit of the disease, we have to judge, and we should not be biased. Like I'll operate this, I'll not. So it's ethical practice, and best part that you're doing justice to your profession.
No, Altaf has said perfectly.
Okay, so yes, that's all. Thank you very much for your valuable time. Have a great day ahead.